Surgical errors basically embrace a lot of topics intraoperatively during the course of many procedures. There's orthopedic surgical mishaps, there are anesthesia procedures, there are laparoscopic, which is microsurgery type of procedures. Many complications arise during a very specific type of procedures, most specifically being an infection, hospital-acquired infections, infections associated with actually the appliances that are placed in, whether or not it is a knee replacement, whether or not it is a mesh, or certain things that are foreign to our body. A lot of infections do develop after the surgeries themselves, which then brings in the questions of post-operative management. You have situations with nurses and their assessment of patients in fevers, in ulcers, and other skin breakdowns that have to be properly monitored. Medication errors are probably one of the largest mishaps that happen nowadays, especially with a lot of new medications being put out into the market. There's a lot of causes with medication errors, from simple handwriting mistakes that physicians make with regard to the legibility, how clearly they write it down, and then when a patient takes that to the pharmacist is trying to figure out what is written. So you have problems with the actual medication being given that's wrong. You have dosage problems where the correct dosage is not given, and then you have over-medicating. You have questions associated with generics versus brand names. There's a lot of overlap. If a patient is given 2 or 3 medications, you have to be concerned about the interactions, the adverse effects, the reactions to the patients. There's a lot of allergies that patients have to medications. It's incumbent on the physicians, the nurses, to know what a patient's allergies are. So there's a lot of mishaps associated with medications that really stem from simply writing the wrong medication, giving too much of the medication. Because if you give too much medication, obviously it has toxic effects. If you give too little of medication, it's not effective, and therefore you can have problems with not having the appropriate dosage. We will look and assess a lot of the bottles, get the scripts from the pharmacy. A lot of those have to go back to the chain of command, which comes back from the doctor's office. These are the checks and balances that really run from the doctor to the pharmacy, because the patient is taking what they believe and entrust to the doctors. A lot of the patients are not picking up a PDR or physician's desk reference to know, and they're just trusting the pharmacy that what they're getting is accurate. So without necessarily a picture to show them what pill they're taking, they assume that what they're taking home is what was prescribed.